Have you seen?
Hello.
Hello.
Sorry, you can start already.
Okay, so we will be starting our today's health talk, and I'll pass over the mic to you, Suhaila. Thank you.
Hello, okay, thank you everybody. Today our health talk, right, is on elderly depression, tips on self-cope and caregiving. So first, okay. So what is the content of this talk is roughly we're going to just say what is this depression, signs of elderly depression, causes of depression, the treatment available, and tips to cope with elderly depression. Okay, so now I'd like all to think are you an elderly with depression? So do you, I will ask like a few questions like, have you lost interest in the activities you used to enjoy? Do you struggle with feelings of helplessness or hopelessness? Or do you find it difficult and hard to get through the day? Okay, so if the answer is yes, right, actually you're not alone. Yeah, depression can happen to any one of us at any age, regardless of our background or our achievements. And the symptom of elderly depression can affect every aspect of our life. And then will impact our energy, our appetite, our sleep, and interest in work, hobbies, and relationship. So unfortunately, right, too many of our depressed elderly fail to recognize the symptoms of depression. So they don't take the steps to get the help they need. So there are many reasons why this elderly depression is so often overlooked. Yeah, usually elderly, right, when they are depressed, right, they assume that they are depressed because they have a good reason for it. Or they have a good reason to feel sad or down. And that they feel like depression is actually a sign of, it's part of aging. They also may be like isolated which is in itself can lead to depression because they are alone. So there's nobody around them to like help to notice that they are in depression, that they are in this phase. Yeah. Then other reasons why is often overlooked is because many realize that the physical symptoms, right, are actually not signs of depression. For example, your body ache, headache, they're very vague symptoms. Okay, they are also reluctant to talk about their feelings or ask for help. So it is important to realize that depression isn't a normal part of getting older, nor is it a sign of weakness or a character flaw. So it can happen to anyone at any age, no matter what background you had or what accomplishments you had in your life. So as our life change with age, right, such as like we had go through retirement, death of loved ones, or declining health can sometimes trigger this depression. So, but we must make sure that they don't keep you down all the time. Yeah, so no matter what actually challenges that we face as we age, there are steps that we actually can take to make ourselves feel better, happier, and hopeful against so that we can enjoy our golden years. Okay, so what is depression? Actually, depression is a serious mental illness that affects any person's daily functioning. One of the most important form of mental disorder. And it's actually not a sign of weakness and not part of normal aging. So okay, so Dr. Mamun, a senior consultant at the Department of Geriatric Medicine, SGH, said that when one reaches late adulthood, above 65 years and above, one is inevitably experience physical decline and some form of loss, for example, loss of health, spouse, family members, or loss of income and independence. So he also added that in Singapore, depression strikes about 6% of the elderly population aged 65 and above. And if depression is left untreated, it can adversely affect the elderly person's ability to recover from serious medical conditions such as cancer and heart disease. Okay, what are the signs and symptoms of depression? Feeling persistently sad, moody and down, becoming increasingly withdrawn, avoiding family and friends, sudden change in eating habits. You either eat too much or you eat too little. Change in sleeping habit. Some people will cannot sleep. Some people will sleep a lot more than usual. There's poor concentration. Cannot do your daily work properly. Always have this feeling of tiredness, and they have this negative feelings such as excessive guilt, worthlessness, and helplessness. And for some, right, they will express suicidal thoughts. Yeah, so it's important to recognize these symptoms so that we can help ourselves and other elderly. So there's a difference between feeling sad and depression. So Dr. Poon Chi Hui, consultant of the Department of Psychiatry, SGH, says that while it is normal to experience low mood when faced with disappointment and defeats, this should not last more than a few days. So or become so overwhelming that the individual is incapacitated with negative thoughts. Yeah. So she also added that these negative emotions such as hopelessness and this worthlessness should not persist more than 2 weeks. Yeah, if not, you may be suffering from depression. Dr. Poon also explained that depression is a mental illness that requires not only professional help but also support from family and friends. Yeah. So sometimes, right, when we talk to a person who is depressed, we will ask them, try not to think so much or try to get yourself out of it. But sometimes it's easier said than done So she said that these individuals, right, as much as they wish to come out of it, right, they are actually unable to do so So what are the causes of elderly depression? So health problems. For example, so health problem, illness and disabilities, chronic or severe pain. So when somebody is in pain or somebody have cognitive decline or damage to your body image, they will have this feeling of depression. Another point is loneliness and isolation. So when you live alone or living alone, single, or your circle of friends is reducing due to death, or sometimes you relocate to another place, so your circle of friends is less, could also contribute to this depression. Reduced sense of purpose, for example, like retirement can bring about a loss of identity, status, can also make you lose your self-confidence and financial security and increase the risk of depression. Physical limitation on activities that they used to enjoy can also impact their sense of purpose. So fears, for example, those people with fear of death or dying, as well as anxiety over financial problems, right? Health issues can also cause this depression. Reason death so death of family members, friends, or pets, or loss of spouse or partner can also contribute. Medical condition, it's important to be aware that some medical problem can cause depression in older adults and elderly, either directly or psychologically to illness. For example, if a person has stroke, right, they will have unable to move on one side. So this can cause them to feel depressed. Another point is side effects of medication. So some symptom of depression can also occur as a side effect of many common prescribed drugs. So if you are taking multiple drugs, you're at risk because some drugs will have these side effects that cause you to have low mood. Yeah, so as elderly, right, for some people, like normal people, when they take these drugs, they are okay. But because elderly, as they reach their the efficiency and the metabolizing or the processing of the drug in the body, right, is slower. So that's why they cause all these changes. Some examples, right, include like some blood pressure medicine, or some tranquilizers can cause some effects on the mood lah. Okay, so how to treat it? So depression is often treated with antidepressants lah. That's the base, the first line of therapy lah. Yeah. So doctor usually select the lowest, most effective dose of an antidepressant medication which is most suitable for the patient. But then for those that cannot respond to this antidepressant therapy or cannot tolerate this medication or at high risk of suicide may benefit from other forms of treatment like this electroconvulsive therapy lah, ECT. So this ECT, right, is usually done as inpatient where the person is put on GA, general anesthesia. So they will put some wires to stimulate the brain to have a fit lah. Yeah. So after that, so this ECT works for some and doesn't work, but may not work for others lah. So it really depends. Other non-medical approaches to treat depression include counseling and psychotherapy. Okay, tips to cope with elderly depression. So it's actually a myth to think that at a certain age, right, we cannot learn, we cannot do new things. Actually, even when we get older, right, they can still learn new things and make lifestyle changes. Yeah, so the human brain never stop changing. So it doesn't mean as you get older, you cannot learn or you cannot do new things. So overcoming depression involves finding new things you enjoy to do and learning to adapt to changes and staying physically and socially active and feeling connected to the community and your loved ones. So when somebody is depressed, taking action and putting self-help steps into action can be hard because you got no mood, very depressed. So it's always good. Sometimes just thinking about the things you should do, feel better can be overwhelming, right? So, but it's always good to like take small steps to make a big difference on how you feel. For example, like you can go for a short walk. If a short walk is what you can do now, right? You can go for a short walk and you might feel better. Your mood will boost your mood better. So for the next 2 hours or so. So at least like every day, if you make this small step, right, in the long run, it will help to benefit you better lah. You'll feel more energetic and you'll feel more helpful. Yeah, so first tip is to reach out and stay connected. So if you're depressed, you may not want to go out or do anything or see anybody. So, but isolation will only make everything worse lah. So on your own, right, it can be difficult to maintain a perspective and get the effort to go out. So that's why support is important lah. So make an effort. You need to make an effort to like stay connected to others and limit the time you're alone. If you can't get out to socialize, you can invite loved ones to visit you or keep in touch over the phone or email. Okay. Volunteer your time. So volunteer time is like you can spend time helping others. Is to make yourself feel better, because when you help others, you will somehow make yourself feel better lah, and also help to expand your social network. Join a depression support group. By joining a depression support group, right, you are being with others that have the same problem, and this can help to reduce social isolation. Yeah, and also help to inspire. It will also help to like inspire to hear others how they cope with their own depression. You can try and take care of a pet, because for example, a cat or dog, like walking a dog can actually be a good exercise for you and a great way to meet people, those dog lovers. Or you can take a class or join a club to meet like-minded people like yourself with the same interests. Great opportunities to laugh. So laughter will provide a mood boost. So maybe you can share humorous stories with your friends or joke with your loved ones. Okay, finding meaning and purpose in life. So focus, because when you are depressed, you'll find like this life has no meaning. Yeah, there's no purpose in life, no reason to continue on. So you need to focus on what you still can do and not what you used to be able to do. So for example, like last time you can sew clothes for others. Right now, but now you cannot. So you can actually try to find other things that you can do, like learn a new skill. Yeah. Then get involved in your community. So try attending like a local event or do volunteering work. Yeah, so community work can be great lah, of helping yourself to pass the skill that you already know to others. Yeah, then taking pride in your appearance. So that is very important. If you take care of yourself, yeah, you will feel better. So sometimes like when you retire, you feel like you just no need to wear nice clothes, no need to make up, no need to just go out anyhow looking. So sometimes if you dress up a little bit, you make yourself feel better lah. Yeah. For some people travel, so if you can travel, it will be good lah to other countries. But if not, right, traveling doesn't mean you have to go to other countries. Right? You can actually just take a trip to the beach, or stay in a local hotel to just have some time, enjoy yourself lah. Okay, third tip, right, is to adopt healthy habits, is to move your body. So when you're depressed, it can be hard to be motivated to exercise or eat healthy food. You tend to snack on anything. Yeah, so move your body lah. So you need to exercise, because exercise is actually a powerful depression treatment. Yeah. Okay, so actually exercise, right? If you engage in gentle physical exercise to relieve symptom of depression, example walking, yoga, and tai chi, this activity actually releases endorphins, which are feel-good chemicals produced by the brain. Yeah, so if you can have group exercise program, will prevent social isolation, improve depressed moods, and prevent functioning decline. So you need to eat to support your mood. So you need to eat healthily lah. Reduce your sugar and your carbohydrates intake. Focus on good quality protein, healthy fats, and going to So you need to try to eat every 3 to 4 hours. If you don't eat like longer than that, right, you will feel very lethargic and moody. Support quality sleep. Okay, so many older elders, right, have difficulty sleeping. Yeah, insomnia. They cannot sleep at night. So we aim, right, to actually sleep at least 7 to 9 hours every night to sleep. With good, you try not to drink alcohol and caffeine, and make sure you have a regular wake sleep time lah. Yeah. Then make sure that you try to have your bedroom dark, quiet, and cool. Yeah. Spend time in the sunlight. So spend time in the sunlight is actually to go out. Yeah, sunlight can actually help to boost your serotonin levels and improve your mood and cope. Yeah, and cope with your depression. So when actually no need to go out so long, like 15 minutes a day in the sun is good enough also. Okay, tip 4, know when to seek professional help. Yeah. Okay, so therapy, right, works best on depression because it addresses the underlying causes of depression. So because you talk about what is the thing that is causing you to be depressed lah, rather than just treat the symptoms. Yeah, counseling will help you talk it out. Okay, supportive counseling. They have therapy. This supportive counseling include like religious and peer support counseling. It helps to ease loneliness and hopelessness of depression and help you to find new meaning in life and purpose. Then other than that is the support group for depression, illness, bereavement, connect you with others who are going through the same challenges. And then another one is antidepressant lah, medication. take your medication as prescribed. Yeah. So how to help an older adult with depression? So if you know someone who has depression, how can you help them? So actually, you need to be there. You need to give them emotional support. So because the elderly seniors, when they are depressed, right, they feel like they cannot tell others that they are depressed. They feel like it's a mental disorder, yeah, and it's not a real illness lah. So sometimes they are too proud or too ashamed to ask for assistance, and fear of becoming like a burden to their families. So if an elderly you care about is depressed, right, you can make a difference by offering this emotional support, like listening to your loved ones, yeah, patiently listening and show compassion lah. We don't criticize their feeling, whatever they say, right? We just, we don't try to fix someone's feelings. Depression, we just listen, and then if they point out like negative things, we try to point out realities and offer hope to them. Yeah, so we also encourage, if you have someone you think is depressed, is to bring them to see a good doctor and accompany them for their appointments, so they feel like they are supported. So other tips of helping a depressed elderly or loved ones. So if you know any elderly that are depressed, you can actually invite them to your house or invite them to come out. Yeah. Or you can schedule regular social activities together so that they will be less alone at home. Plan and prepare healthy meals, because healthy meals will really help to improve their moods. Yep. Yeah, they should take like more vegetables, more fruits, whole grains, and some healthy proteins. Yeah. Then encourage the person to follow through with treatment. So always, because usually, right, if somebody who is depressed, they will halfway don't want to go for treatment. So it's good to always encourage them to follow up until they feel better. Because if they stop, right, then their depression will be like 2 times of what it was before. Then also watch out for suicide warning signs. So if you feel like there's somebody who feel like they want to commit suicide, or they say to you, then you should know where to seek help lah. Like call what number, yeah, or inform the doctor in charge. Okay. So take caution, do not ignore changes in mood or behavior in your elderly parents. Watch out for signs of depression and do not hesitate to get help. If you are a senior, do let your doctor know about your emotional health. Okay, here are some resources that you can, if you think that you need help or you think somebody need help, can go to this can call this 24 hours mental health helpline, IMH, 24 hours Samaritans of Singapore, SOS. For men having some issues, they can call this number, Men in Crisis Helpline. There's also this Shan Yu Counseling Center, which provide also Mandarin speaking, counseling, and Silver Ribbon Singapore. Okay, that's all for my presentation. Do you have any questions?
Hello, thank you, Suhaila, for this sharing. I think this topic is slightly sensitive, as well as some of us may be going through and we don't know how we can actually help ourselves, or even we have seen friends who have actually gone through I mean, I'm not elderly lah, but it's more of like if you have seen any of your friends having the elderly depression and you don't know how to help, we hope that with the sharing provided, it will actually be able to help your friends, of our families, or relatives who are actually going through all this. And it's definitely not easy, even though there's a guide saying like the Suhaila shared about going to seek a therapist, but then you're afraid of a lot of other comments made by other people also, right? So it's a very difficult step for you as well. So can try to take a small little step to make small changes. Step by step is actually a way to allow yourself to feel better also. So any questions or any sharings that you all would like to share with us as well? We see people coming in. For those who have joined us, we have actually done our sharing for the day. So now it's actually a Q&A time.
Okay, I thank you for this, Florence. I thank you for the sharing, which some of the points, and honestly, I've got an elderly friend who is very good. She opens her house for friends to join, and we usually play Ramio, you know. It is a good game to engage and help our brain work. You get me? So when you have this kind of social gathering, it's good to have game, and then we will have tea, you know, a kind of gathering which is healthy lah. I find this is good. Hello?
Yeah,
Can you hear
correct.
me?
Actually,
Yeah, okay.
social group meetings is good to prevent isolation. So it's good to meet up with your friends sometimes. Yeah. It's just that sometimes when people are depressed, they do not want to go out. So if you know they are depressed, you can actually invite yourself to their house or ask them to come out with you.
Correct. I'm very thankful this friend opens a house for this, because now limited to 5. So we still keep to such rule. We didn't violate the rule. So she will call, okay, today 5, including herself. That means can only invite 4 friends. Almost no, at least 3 times a week, her house is open for all this kind of gathering. You try to encourage. Yeah.
Yeah, correct. She actually trying to make herself feel better, which is good lah.
Because she cooks very well. My this friend, you know, the Peranakan food and very good, and then healthy food. And she herself very active. She volunteers at many places. Yeah, thank God for all this. I mean, I am very thankful, and hopefully, you know, can open for more of such law. Yeah. She even visits those invalid, you know, friend, from stranger she makes friend, and then every month she will visit this friend, wheelchair, and then we'll buy lunch or bring her out. Yeah, I appreciate this friend who has done a very good job. Yeah.
Volunteering also helps lah. It makes you feel better also.
Yeah. Thank you. So these are the points. Some of those tips pointed out. She's really fully qualified to do this kind of volunteering. Yeah. Thank you.
Thank you. I think it's a very nice gesture and something that we all can learn from Florence's friends as well. I think during this COVID season, we might be a bit apprehensive. Like, I don't know whether they should come to our house or not. I don't know you're vaccinated already or not. But then if you're actually close to those friends of yours, learning a helping hand or even going out for a quick tea with them also do help as well. So thank you for sharing, Florence. It's
Okay.
good learning.
That's last Friday I was there. Yeah, I was delivering something for a friend and we met there. So yeah. And then I stayed for dinner, of course, because 4 years. I mean, we are friends of more than 40 years.
And how can you say no to the Peranakan food that you mentioned earlier on?
Yeah. So just share a bit of what and encourage, you know, such kind of activities. So Thank you.
Thank you. We are so happy that we have such good friends with you around. Anyone have any other questions or would like to share your experience as well?
Maybe I would like to share. I feel morning going out to walk or do some exercise in the town park or the stadium. My own experience last year at near I think around I think it's in November I started to do so, and nearly 1 year already. I find it very good, and not only go out to exercise because we always meet the same people. Then we even just hi and bye. Then like quite happy. Yeah. So I think I thank you very much for the talk. When I listening to you, I feel good. Actually, may I say that even join this health talk. Yes, I feel very good. Yeah, the knowledge and we receive, and yeah, and like we can like just how you mentioned about exercise and many points. Even I don't have a depression, but be frank. Sometimes because this period of time, the pandemic, we cannot be like last time always go out. But yeah, I encourage. Really, prevention is much better. Now we have no, because I listen to you. The causes of elderly depression. Yeah, we rather
Can avoid it lah. You mean to avoid? Yeah, prevention.
Yeah, do as exercise. But even you at home exercise, it also is also good for our physical body. How about we go out the morning air, the sunlight. Yeah, very good. I feel because I myself benefited by it. So I just share. Thank you.
Thank you, Christina.
Yeah, thank you. I think it's a very good valid point where about the fresh air in the morning. I also sometimes I walk to my MRT to take to work, right? Then I see got no people, then I secretly take out my mask for like a quick 30 seconds. Then you inhale the fresh air, it actually makes yourself feel a lot happier as well. So it's one small motivation for you to go out as well.
True. Yeah, that's right.
Yeah.
It's very. I'm thankful for this because I received very late just now. I was occupied with laundry. So then when I check, oh wow, very short time. I quickly forward to many friends. I don't know whether, but I know one of them watching. But I mean, attending. I'm very thankful. How many I do not know because honestly, I used to laptop is to listen because the screen is bigger. Then my handphone I on, but I mute it. Is to take the notes. I screenshot the notes. So I have two. You see two Florences. Because taking picture from the screen is always blur. So using handphone screenshot is useful and very clean also. That's how I sort of my way of enjoying such talks. And this morning the exercise was very good. I'm very thankful that Yong En or the Health Promotion Board have come up with such activities to engage us at home. Zoom, I'm used to Zoom now already, a lot. Somehow, yeah. Very thankful for all these activities.
No problem. We're glad you enjoy. I believe Radiva's Silver Click activities, there's actually activities as well for exercise also for those who wish to join, or even Yong En or NTUC Health, they also do provide morning exercise for you via Zoom as well. But we hopefully by next year the pandemic will be better.
Yeah.
The pandemic will be over, not better, sorry, will be over. Then
Yeah.
everyone can meet face to face also will be even a better point to keep touch with everyone.
Correct.
Yeah.
I'm looking forward to go back to my gym tonic, the Bishan gym tonic. Now the center is open, but I haven't I sort of haven't taken the assessment because they are very strict in a way, which is good. But good enough that I have the Zoom session. You still move, the body still move, exercise. This morning was good. It was for fall, prevention of fall. So very good. The trainer was very good. Yeah.
Okay, so actually you mentioned about the taking screenshot of slides. Actually Radimas also put out this sharing on their Facebook, and I also remember they also have a YouTube page now, correct, not Gary? So
Yeah, I
you all
think
can
so.
actually look through the slides again, the recorded slides shared by our nurses on the Facebook or from YouTube as well.
That's good.
If you don't mind, I share my how to say, I encourage so sorry, I don't know how to say. Because I very feel good. I think we can read. I think many of us here are quite elderly. I think reading, playing musical instrument, especially ukulele for elderly people, is quite easy to learn now. Even you just learn a few chords, you can play many songs. And the other thing is singing. Yes, and when I watch the TV programs, I also at the same time I play the puzzle games. I find it so interested. This is my own life experiences. Just share.
Very good. Yeah, very good. I also looking forward to learn ukulele. Not yet. Interested, but have not started. Yeah, but I enjoy singing. Yes. Singing is good. You train our vocal cord at the same time. Learn how to sing from diaphragm. Because I was from a choir, although now stop, cannot sing. Even in church service, you're not allowed to sing. It just has to hum only. Yeah. So that's how it's healthy in a way, because it also help in how to breathe. When you sing, you learn how to breathe well. Yeah.
Yes. Thank you, Florence and Christina, for the great sharing and all the tips and hobbies that you all like to do and share with the others. Just in terms of the time, anyone who would like to unmute yourself also to actually share with us, or any questions you would like to check as well?
I can share also.
Okay, yes, please go ahead.
Previously I was from Red Hill then because of the M Block I moved out already. So I was an RC member there. So when I came over to my new place, I also became an RC member. So I have start up the interest group for the Ramio like what they say. So this Ramio group at first when starting, a lot of seniors say, "Oh, I don't know how to play Ramio. What is this game? I never hear before lah." So I encouraged them to join. Then when they started playing, then slowly they gain an interest, and then now become they almost like to play almost like every night. But because of the all this safe distancing thing, so not encouraged to meet so often. So they only meet like once or twice a week to play. And then now when they play, they are quite slow at playing. And then after that, sometime you can find that their brain seems to be quicker. They can match the numbers and color very fast, and they can do one game quite fast. Instead of last time, took quite long to finish one game. So I think it really probably this game will prevent dementia. So I think that that's quite recommended to seniors. Okay, thank you.
Yes, thank you. I think it's bring back to what our staff nurse shared earlier is don't be afraid to learn new things and you lost your previous skills. So learning a new stuff, be open to it and slowly get the hang of it, and so you'll be a master of another piece of topic that you are good at also. Okay, thank you for sharing. So Madam Chan and the rest of the ladies. So it's good to hear all of you. So if there's no more questions, then we will probably end today's health talk. So for next week, it's actually in Mandarin. So for those who miss this English version or just join us later at the part of this health talk today, right? You can actually listen to the Mandarin version, will be on 20th of December. So don't worry, our health talk will still continue next year as well, and we will be sharing with you other health topics as well. And there will also be like fall prevention. You all mentioned you all like to do the fall prevention exercise also, right? So we also have health talk on fall prevention as well. So how you can actually take good care of yourself as well. So if you have no other questions, then thank you once again for everyone for joining.
Thank you very much.
Thank you, Suhaila, for the sharing.
Thank you.
Thank you. Bye.
Thank
Bye-bye.
you. Bye-bye.
Thank you. Bye-bye.